If you notice mild numbness, mention it during your next checkup. It's an early red flag. 2. Pins and needles or tingling. Imagine lying in bed when suddenly your toes feel like tiny needles pricking the skin or like a buzzing under the surface. That pins and needles sensation is classic for nerve irritation. What's happening? Tingling usually reflects small fiber dysfunction. Those smaller nerve fibers transmit pain and temperature signals, and they can become hyperactive or erratic before they quiet down. Why it's missed? Many people call it poor circulation or blame their mattress, and because it often fades or happens at night, it's easy to forget to report it. Caregivers may not see it because it's subjective. Why it matters? Recurrent tingling is an early sign of nerve involvement. It can wake you up at night, reduce sleep quality, and be a prelude to more persistent numbness or pain. Tell your clinician so they can evaluate the pattern, frequency, triggers, and whether it's symmetrical. 3. Burning sensation. This one is vivid. Your toes feel like they're on fire or like a hot stone is under your soles. Burning pain is particularly distressing for many older adults. What's happening? Burning often points to damage in the small pain fibers. These fibers can fire continuously, producing a steady, burning discomfort that sometimes worsens at rest or at night. Why it's missed? People may describe burning as arthritis pain or dismiss it as foot fatigue from walking. Because it's uncomfortable, some reduce activity, which can hide the true cause. Why it matters? Persistent burning signals signal small fiber neuropathy, which needs attention because it affects daily comfort and sleep. If this is one of the signs you notice, it's worth noting start time and whether anything eases or worsens it. 4. Allodynia, pain from light touch. Think of a gentle rub from a blanket that suddenly stings, or the fabric of a sock causing sharp discomfort. Pain from something that shouldn't hurt is called allodynia. What's happening? After nerve injury, touch-sensing pathways can become miswired. Light contact activates pain circuits instead of simple touch. It's a sign the nerves are not responding normally. Why it's missed? Because it's variable. Sometimes your foot tolerates socks, other times it flares. People say it's moody or related to shoe fit. They might change socks or shoes and not mention the pattern to a clinician. Why it matters? Allodynia indicates heightened nerve sensitivity and can be very disruptive. If clothing or a bedsheet causes pain, mention this to your clinician as it points to altered nerve signaling that may respond to evaluation. A quick reminder in the middle here, if you're living with diabetes, high blood sugar doubles down on these sensory problems. If you're on certain medications or suspect a vitamin deficiency, add that to the list to talk about at your visit. And if you feel 2 or more of the symptoms we're describing, pause the video and write them down. That cluster pattern is more concerning than a single isolated sensation. 5. Reduced vibration sense. A simple scenario. You no longer feel the subtle hum of a mobile phone vibrate through your foot, or a small metal object under your toes fades into a blur. That reduced vibration sense is less sexy than sharp pain, but it's clinically important. What's happening? Vibration is detected by large myelinated nerve fibers, the same fibers that help with balance and knowing where your feet are in space. When these fibers are affected, vibration perception fades before other sensations sometimes do. Why it's missed? People assume vibration is something only neurologists check with fancy tools. Because it's not painful, it doesn't trigger a visit. Also, unless someone tests you, you may not even know it's diminished until you lose confidence walking on uneven surfaces. Why it matters? Loss of vibration often indicates large fiber involvement, which increases the risk of balance problems and falls. If you notice this kind of blunting, you don't sense the subtle things that used to be obvious, make a note for your clinician. 6. Temperature insensitivity. Picture stepping into a warm bath and not feeling the heat as distinctly, or picking up something slightly warm and your foot reacts late. That muted response to temperature is a caution sign. What's happening? Temperature is carried by small fibers. When they're damaged, you may not tell cold from warm quickly. This reduces your ability to protect the foot from thermal injury. Why it's missed? You might attribute it to the weather or thick socks. Because it's gradual, you compensate with behavioral changes and the symptom becomes part of routine. Why it matters? Not sensing excessive heat or cold raises the chance of burns or frostbite on exposed toes and makes other injuries less noticeable. If your toes feel unusually blunt to heat or cold, that's a conversation to have. 7. Paresthesia, sensations like insects crawling or electric shocks. Some people describe a creepy feeling, like something is moving under the skin, or sudden brief electric shocks that shoot through a toe. These sensations, known as paresthesias, can be startling. What's happening? Erratic firing of damaged nerve fibers produces unusual perceptions, crawling, tingling clouds, or short electrical jolts. It's a sign the nerve is misfiring. Why it's missed? Because these episodes are intermittent and sometimes happen at night, they're easy to put down to stress, poor sleep, or even restless legs. Families may not hear about them if the person doesn't complain. Why it matters? Recurrent paresthesias often precede sustained numbness or pain. When they start affecting sleep or daily comfort, it's time to have a clinician listen and examine the feet. That next symptom, the one most people tell me they ignored, is the subtle change in how their toes feel in shoes. Many seniors switch shoes or wear thicker socks and chalk it up to comfort, not a nerve problem. Don't be one of them. A short clinical perspective. These sensory signs often divide into small fiber and large fiber patterns. Burning, temperature problems, and sharp pains point towards small fiber involvement. Numbness, vibration loss, and balance trouble tend to mean large fiber issues. But in many people, both fiber types are affected over time, so mixed symptoms are common. What really raises concern is not one symptom alone, but a combination. 2 or 3 early signs together should prompt a conversation with your clinician. Practical examples to help you self-observe. Notice when you put on socks in the morning. Do they feel the same on every toe? When you walk barefoot around the house, can you feel small objects underfoot? Do you wake up at night with tingling that thaws after you move? These are simple self-notes that help your provider understand the pattern. Why early detection matters. Nerves don't always recover fully when they're left to progress unchecked. Identifying the problem early can lead to treatment of reversible causes. For example, correcting a vitamin deficiency or adjusting a medication that may be contributing. And it allows clinicians to start protective measures that reduce the risk of sores, infections, and balance-related falls. I want to be clear, we're not promising cures here. Rather, early evaluation gives you options and can often slow or limit further damage. Before we move on to the motor signs that affect strength and movement, a quick clinical tip you can use when you talk to your clinician. Describe the pattern. Which toes, which times of day, whether the sensation is symmetrical between feet, and whether anything seems to trigger or relieve it. Those details help decide whether simple clinic tests like pressure sensation checks or vibration testing are appropriate. We're about to shift into the signs that show up when the nerves start to affect movement. Subtle weakness, cramps, and reflex changes that often sneak up and are mistaken for weak ankles or arthritis. Those motor clues are where balance and walking begin to change, and catching them early can prevent slips and falls. Now let's go through the motor clues, the subtle changes in strength and movement that can quietly alter how you walk, stand, or handle small movements with your toes. 8. Mild toe weakness. Scenario. You notice your toes don't curl as strongly when you pick up a small item off the floor. Or the top of your shoe feels looser because your toes aren't holding it the same. On the stairs, you may feel like you have to concentrate more to lift your foot. What's happening? Motor nerve fibers and the small muscles in the foot are losing some of their ability to contract. The nerves that tell muscles to move may be only partly impaired at first, producing a subtle drop in strength rather than a complete loss. Why it's missed? Because it's gradual, you adapt. You slide your foot under a rug, change how you step, or avoid chores that feel trickier. Friends and family may think it's normal aging or getting clumsy instead of a nerve warning. Why it matters? Early weakness can change your gait and increase trip risk. It can also lead to deformities over time if the muscle balance around the toes shifts. If you find yourself consciously lifting your feet more or catching your toes on rugs, mention it to your clinician. Takeaway: if your toes feel weaker than they used to, especially on one side or slowly worsening, write it down and bring it up at your next exam. 9. Frequent toe or foot cramps. Scenario: you wake at night with a tight cramp in your toes or the ball of your foot, or you get sudden squeezing pain in the toes after standing for a short while. What's happening? When motor and sensory nerves are irritated or partially damaged, the signals that regulate muscle tone and relaxation can become erratic. That may lead to spontaneous contractions, cramps in small foot muscles. Why it's missed? People call these Charlie horses, blame dehydration, or assume they're from standing too long. Because cramps are common and intermittent, they're often not linked to nerve health. Why it matters? Recurrent cramps, especially when paired with numbness or tingling, suggest a neuropathic process that affects both sensory and motor pathways. If cramps disturb sleep or appear more often, it's a useful clue to tell your provider. Takeaway: note when cramps happen, time of day, relation to activity, how long they last, and share that pattern with your clinician. 10. Difficulty with toe coordination, tripping or toe dragging. Scenario: you find yourself scuffing the front of the toes on carpets or rugs, or your toes don't clear thresholds the way they used to. Walking on uneven ground feels suddenly precarious. What's happening? Large fiber damage affects proprioception, your brain's sense of where your feet are in space. Without accurate feedback, your foot may catch or fail to lift as needed during steps. Why it's missed? Many people think a stumble or a scuff is a one-off, or they blame poor lighting or fatigue. Because these coordination lapses may be brief, caregivers may not see them. Why it matters? Repeated coordination problems increase the risk of falls. Even slight changes in foot clearance can lead to sprains or bruises. If you or a caregiver notice more frequent scuffing or trips, it's time to be evaluated. Takeaway: track whether scuffing or near falls are becoming more common. Those moments are important to report. 11. Reduced reflexes at the ankle or toes. Scenario: in clinic, a clinician taps your Achilles and you or they notice a slower or diminished ankle reflex. Or you feel your toes respond less when the sole is stroked during an exam. You may also sense your ankles feel less springy when walking. What's happening? Reflexes rely on intact sensory and motor fibers. When these pathways are impaired, the reflex loop weakens and produces a dampened or absent response. Why it's missed? Reflex changes aren't obvious outside a clinical exam, so they're often only discovered when someone is examined. Patients might report stiffness or a different walking rhythm rather than reflex loss. Why it matters? Decreased reflexes are an objective sign that nerves are involved. If a clinician documents reduced reflexes, it often prompts further testing to understand the extent and pattern of nerve damage. Takeaway: if a clinician mentions reduced reflexes or you notice changes in walking ease, ask what follow-up tests they recommend. A short clinical reminder: motor signs usually complement sensory findings. Weakness, cramps, reduced coordination, and dampened reflexes become especially concerning when they appear in combination with numbness, tingling, or burning. If you're noticing more than one motor change or motor signs plus sensory complaints, get these noted in your medical record. Now let's move into the autonomic and vascular clues, the quiet signals from the skin, sweat glands, and blood flow in your toes. These are often invisible until they cause a problem, so knowing them helps caregivers and clinicians catch trouble earlier. 12. Dry, flaky, or shiny skin on the toes. Scenario: you notice the skin on your toes looks unusually dry, peels in patches, feels thinner, or has a glossy shine that wasn't there before. Socks that once stayed in place now slip more because the skin texture has changed. What's happening? Autonomic nerves control sweat glands and skin health. When these nerves are affected, the skin can become drier and less resilient because normal moisture regulation is disrupted. Why it's missed? Dry skin is common in older adults and often treated with moisturizers without considering nerve causes. Because it doesn't hurt at first, it becomes a cosmetic problem rather than a neurological clue. Why it matters? Why it matters, dry, cracked skin is more likely to break, allowing bacteria to enter and cause infection. In someone who also has reduced sensation, a small crack may go unnoticed and become serious. If you see persistent or unusual skin changes on the toes, tell your clinician. Takeaway: persistent or unexplained dryness on the toes should be documented and examined, especially if sensation is also reduced. 13. Decreased sweating of the feet. Scenario: your feet don't sweat like they used to. They feel unusually dry even after walking, or the socks don't develop the usual dampness. Or the opposite, one foot sweats less than the other. What's happening? Sweat production in the feet is largely controlled by autonomic fibers. Damage to these fibers reduces sweating, called anhidrosis, and alters the skin's protective barrier. Why it's missed? Changes in sweating are subtle and often attributed to medication effects or age. Because sweat patterns vary with temperature and activity, the connection to nerves is easy to overlook. Why it matters. Reduced sweating affects skin health and increases the chance of cracks and ulceration. Uneven sweating between feet may point to localized nerve involvement rather than a generalized skin problem. If you or a caregiver notice a notable change in how much the feet sweat, mention it during evaluation. Takeaway: sudden or asymmetric changes in foot sweating are worth documenting and bringing up with a clinician. 14. Persistent cold or color changes in toes. Scenario: one or both feet feel persistently cold to the touch, or the toes look pale, bluish, or darker than the rest of the foot, especially after being wrapped in a blanket. You may notice these differences in temperature or color without a clear cause. What's happening? Autonomic nerves help regulate blood vessel tone. When they're impaired, blood flow regulation can falter, leading to temperature and color differences. Small vessel changes can make toes feel colder or change their appearance. Why it's missed? People assume cold toes are due to poor circulation from heart issues or simply living in a cold climate. Color differences are sometimes attributed to footwear or varicose veins. Why it matters. Persistent temperature or color asymmetry may signal vascular or autonomic problems that increase the risk of skin breakdown. It's particularly important if color changes are new or if they occur along with sensory loss, as that combination raises the concern for injury going unnoticed. Takeaway: new or asymmetric toe temperature or color changes deserve prompt clinical attention. 15. Slow or delayed capillary refill in toes. Scenario: press on a toenail or toe pad, let go, and the color takes longer than expected to return. You might notice a slower return of normal color compared to other toes or the opposite foot. What's happening? Capillary refill reflects small blood vessel function and circulation. While many factors affect refill time, autonomic and vascular nerve dysfunction can contribute to delayed return of color. Why it's missed? Unless a clinician checks capillary refill, many people never notice it themselves. It's easy to write off as poor circulation without thinking about nerve contributions. Why it matters. Delayed capillary refill can be an early sign that blood flow to the toes isn't normal. In the context of numbness or skin changes, it should prompt a careful exam and possibly vascular assessment. Takeaway: if a clinician notes delayed capillary refill, ask what follow-up testing they recommend to evaluate both nerve and blood flow health. A brief clinical synthesis. When autonomic signs, dry skin, low sweat, color or temperature change, delayed capillary refill, appear alongside sensory or motor findings, the pattern suggests a broader neuropathic process that affects multiple nerve functions. That pattern raises the urgency of evaluation because skin breakdown and unnoticed injuries become more likely. Practical red flags and simple caregiver checks. You can't and shouldn't run clinical tests at home instead of seeing a clinician, but caregivers and seniors can observe useful signals that make the clinical visit far more productive. Keep a short note with these observations. Which toes show numbness, tingling, or burning and when they happen? Whether sensations are the same on both feet or stronger on one side. Any changes in skin texture, color, or sweating. New scuffing, tripping, or foot weakness while walking. How frequently cramps or paresthesias wake you at night. If you can, have someone check your feet weekly for blisters, cuts, unusual redness, or areas of thickened skin. Early signs that often precede bigger problems are small calluses in unusual locations, tiny ulcers that don't hurt, or persistent areas of discoloration. These observations are powerful when you bring them to your clinician. What to expect and what to ask at the clinic, tests and evaluation. If you decide to see a clinician because of 2 or more of these signs, here are common, non-invasive assessments you might expect them to consider. These are tools to help clinicians form a diagnosis. They're not meant to replace medical judgment. Monofilament testing. A clinician may use a thin nylon filament to test light pressure sensation on the toes and other parts of the foot. It assesses protective sensation. Vibration testing with a tuning fork, commonly 128 Hz. This evaluates large fiber function related to vibration and position sense. Reflex testing. The clinician may gently tap the Achilles tendon or other reflex points to assess reflex responses. Nerve conduction studies and sometimes electromyography. These tests measure how well nerves transmit signals and how muscles respond. They are more detailed and may be recommended if initial exams suggest significant or progressive neuropathy. Basic laboratory workup. Many clinicians will consider blood tests to look for contributing or treatable causes. For example, blood sugar control, vitamin B12 levels, thyroid function, or other metabolic contributors. Your clinician will decide which labs are appropriate. How to bring this up with a clinician. When you speak with your clinician, be concise and specific. A helpful script might be, in the last X months, I've noticed numbness in my toes, burning at night, and my feet feel unusually dry. 2 toes scuff on rugs more often. Could we check foot sensation and vibration and consider tests for neuropathy? Saying the timeline, whether symptoms are on one or both sides, and whether anything makes them better or worse, helps your clinician choose the next steps. Remember, the aim of testing is to identify causes that can be treated or factors that can be managed to protect the feet and reduce further nerve loss. Tests can also help rule out other causes that mimic neuropathy. How treatment and management are framed, what you can expect? I want to be direct. I will not promise fixes or guaranteed reversals. What evaluation often allows, though, is identifying contributors that can be addressed, for example, better control of blood sugar or identifying a vitamin deficiency, and putting in place protective strategies that reduce the risk of ulcers, infections, and falls. Managing neuropathy is frequently a combination of treating or controlling underlying contributors where possible, medical decisions made with your clinician, protecting the feet through proper footwear, skincare, and routine checks, addressing balance or gait changes with physical therapy if needed, monitoring and early treatment of skin breaks or infections. Those are general directions, not step-by-step instructions. Your clinician will recommend specific plans tailored to your overall health and test results. Consequences of delay, a balanced view. Why emphasize early signals? Because the sooner a pattern is recognized, the more options you and your clinician have. Early steps often help prevent small problems from becoming larger ones. For instance, treating contributing factors and improving foot protection can reduce the chance that a small sore becomes infected. That said, my goal is not to alarm you. Not every mild symptom becomes a crisis. What I want is for you to understand that quiet changes can precede more important problems. Listening early increases your choices. Ignoring clusters of signs makes serious consequences more likely, especially if sensation is lost and skin injuries go unnoticed. A return to Margaret, the practical difference early attention can make. Let's go back to Margaret for a moment. When she finally sought care, her clinician documented widespread numbness and a small ulcer she hadn't noticed. The ulcer required close treatment and a period of reduced mobility that set back her garden routine and independence. If Margaret had brought a checklist of early signs, the subtle numbness, occasional burning at night, and a change in skin texture she'd seen weeks earlier, she might have had tests and a protective plan before the sore developed. That's the practical difference. Early conversation, testing, and protective strategies often stop small issues from becoming life-altering complications. When should you schedule an appointment? If you recognize 2 or 3 of the symptoms we described, for example, numbness plus burning at night, or dry skin with decreased sweating and mild weakness, it's a reasonable time to call your primary clinician for an evaluation. If you're unsure, a short phone consult can help prioritize whether an in-person exam is needed. When to go sooner? If you discover a cut, blister, or sore on your foot that you can't explain, or if a skin break shows signs of infection, increasing redness, swelling, drainage, seek care promptly. Those situations require immediate attention because reduced sensation can allow infections to worsen quickly. Practical, everyday protective habits, non-prescriptive. A few practical ideas that clinicians commonly recommend to protect foot health. These are general habits to discuss with your care team. Inspect feet daily or enlist a caregiver to check visually and by touch if you have difficulty reaching your feet. Keep skin moisturized to prevent cracks, but avoid putting lotion between toes where moisture can be trapped without clinical advice. Choose well-fitting shoes and avoid walking barefoot on rough or cold surfaces. Bring a written list of symptoms and their timeline to your appointments. Details help clinicians decide what tests to order. If you have diabetes or blood sugar issues, regular foot checks should be part of your routine care. Again, these are protective habits rather than medical prescriptions. Your clinician will tailor guidance to your situation. A clinician's short checklist for patients, what to mention in the visit. When you sit down with a clinician, touching on these points makes the visit efficient. Start date and progression. When did you first notice changes? Have they worsened? Symptom pattern, which toes or parts of the foot? Are both feet affected? Are symptoms worse at night or with activity? Associated signs, any skin changes, sweating differences, or difficulty walking. Medical context, diabetes, vitamin deficiencies, recent medication changes, or other conditions. Functional impact, are you tripping more? Are you avoiding activities? Are sleep and daily life affected? This focused information helps your clinician decide on the right sensory tests and whether specialist testing might be needed. Common questions patients ask, answered briefly. Q. Will my neuropathy come back after treatment? Outcomes vary. Some causes can be corrected or improved, others can be managed so progression slows. Exact results depend on the cause and timing of detection. Q. Is neuropathy always painful? No. Some people have pain and burning, others have numbness without pain, and many have both at different stages. Q. Is it always due to diabetes? Diabetes is a common cause, especially in older adults, but neuropathy can result from nutritional deficiencies, certain medications, alcohol use, vascular disease, and other conditions. That's why evaluation matters. Q. Can I check this myself at home? You can monitor symptoms and inspect the skin, but formal sensory testing and diagnostic studies are performed by clinicians. Closing encouragement and summary. Your toes often speak in quiet ways: a muted warmth, a twinge in the night, a sock that suddenly feels abrasive. Those whispers deserve attention, particularly for older adults and people with diabetes or other risk factors. We've gone through 15 specific signs in 3 groups: sensory, motor, and autonomic/vascular. Each sign alone may not signal a crisis, but 2 or 3 together should prompt evaluation. If you've noticed several of these signs, mild numbness, tingling or burning, decreased vibration, subtle toe weakness, dry skin, or color changes, schedule an appointment and bring a short list of what you've experienced. Ask about monofilament testing, vibration testing with a tuning fork, reflex checks, and whether further nerve conduction testing is appropriate. Your clinician will help sort out possible causes and protective steps. A compassionate final word. Catching nerve problems early does not guarantee a cure, but it often expands your options. It allows treatment of reversible contributors, attentive foot care, and measures to reduce the likelihood that a small issue becomes a major disruption. Listening to those toe-level whispers can preserve comfort, mobility, and independence. If this video helped you understand what to watch for, please share it with someone you care about who is over 60 or living with diabetes. And if you want more clear, clinician-tested practical guidance on protecting health as we age, click like and subscribe so you don't miss future posts. If 2 or 3 of the signs we covered apply to you or someone you support, make a note of them today and contact your clinician to arrange a foot-focused evaluation. Your toes may be whispering, and when you listen, you give yourself the best chance to act early.